Hi everyone. Today our final project topic is about poor communication between doctors and nurses affects resource management in hospital units. My name is Nazia Rashid and my group members are Kanis and Sai. And now moving forward, our next slide will be about the YouTube link and then our another slide about icebreaker. Yes. Um, yes, go ahead.
Before we jump into our lesson, we are going to start with a quick icebreaker to get everyone warmed up. This will be a one word check in. I'd like everyone to think of one word that describes communication in your current workplace or even in a past work setting. Your word might be something like chaotic, smooth, stressful, or efficient. These are few of the examples that you could think of. To give you an example from my experience, when I previously worked as a dentist in a private clinic, the word I would choose is exhausting. A big reason was that because communication with management was often unclear, especially around my scheduling and timing, and that constant miscommunication made work life balance very difficult. So, that one word really captured my experience. Now, I would like to hear your one word descriptions. You can share whatever comes to mind. Moving on to the next slide.
Yes. Yeah, now we will talk about the learning objectives and so it will cover about the overview of health topic. There are four main things coming in it, communication breakdown, patient safety and care quality impact, and resources and hospital performance impact, and about leadership role. First of all, about communication breakdown, is just like we can explain it about the doctor and nurses often share unclear, delayed, and inconsistent information, leading to misunderstanding, contradictory expectations, and uncoordinated patient care. Then, about the impact of patient safety and care quality. These communication gaps increase medical errors, high complication rates, prolonged hospital stays, and reduced patient satisfaction and trust. And then it also, all these together will impact resources and hospital performance because pure communication wastes resources, duplicates tasks, delays workflow that cause inefficient use of overall hospital resources. And then finally, also about the leadership role. If there's a strong leadership, then obviously it will strengthen communication by supporting teamwork and S-bar use and consistent care coordination. So this is all about the overview. Next, moving slide. Yeah.
Thank you, Nazia. Now we are discuss about our national and state level statistics, which gives us the prevalence of this issue. According to the Joint Commission, in 2026, around 67% communication error occurred due to the hand-up error, which increased the 30% medical malpractice case, which are associated with 1,744 patient deaths over the 5 years and increased the 1.7 million cost. In case of Texas, the rate is 70.5%. Nurse turnover is also worsened the communication issue. In 2026, the median nurse turnover rate in Texas 23.2%, compared to the national rate is 16.4%, which directly impact on the interprofessional communication and team workflow. Regarding patient decision-making cases, only 17% physician and nurse pair show full agreement and 30% have no agreement, 53% showing the partial agreement. So we can see that communication problem in Texas is more severe than the national average. In our next slide, we are discuss about our problem scope, issue and impact of this issue. So let's discuss about the scope of this problem, who is affected. Poor communication firstly affected the patients. Because the mixed communication, patient stay longer hospital stay, delayed treatment and higher readmission rate. Healthcare provider, doctor and nurse experience stress, frustrations, wasted effort, which reduce the teamwork and overall job satisfaction. In case of hospital and healthcare system, it increase the financial burden. For example, 500 bed containing hospital in Texas increased the $4 million per year due to the workforce disruption due to the poor communication. Poor communication wide-ranging consequences. It increased the economic burden. In USA, hospital wasted more than $12 million due to the poor communication, which increased the economic burden. Around 53% because of the increased the length of stay, 37% because the wasted nurse time, and 6.7% due to the wasted physician time. Due to the high nurse turnover, hospital lost $4.75 million due to the training purpose and economic loss, which decreased the staff turnover. And poor communication also increased the 37% high severe injury cases. In case of medical cases, is 38%. In surgery cases, it is 26%. In nursing cases, it's the 34%. The high-risk patient have a 10% chance of readmission within the 30 days due to the poor nurse and physician communications. So overall, poor communication disproportionately affect the resource management, quality of care, and organization reputations. Now we will go to our next slide.
Thank you, Kanis. As we've seen the scope of this issue, now we know that the implications are high, which is why leadership action is necessary. So I'm going to walk through the implications of poor doctor-nurse communication and why leadership intervention is essential. When communication breaks down, it doesn't just cause frustration. It directly harms workflow, patient safety, resource allocation, and staff morale, all of which we've seen the numbers from what Kanis has shown us. We see delays in care, repeated work, unclear responsibilities, and ultimately extensive financial waste. Leadership plays a major role because communication quality is shaped by the systems, culture, and structures leaders create. Research shows that strengthening interdisciplinary collaboration reduces medical errors, length of stay, and readmissions, all of which will improve the resource management. So, the biggest takeaway is improving communication is not optional, it is a leadership responsibility tied to patient safety, efficiency, and retention. Moving to the next slide. Here we are seeing the micro level strategies. These are actions staff and frontline teams can apply. The first strategy is collaborative conflict resolution and negotiating training. Because resource disagreements often cause tension between nurses and physicians, staff need skills to resolve conflicts in a constructive and integrative way. Collaborative approaches focus on finding mutual solutions rather than placing blame. The second micro-level strategy is using clear interprofessional decision roles, specifically the UID model, which is update, input, or decide. This helps the team understand the purpose of each conversation. Are we sharing information, or are we asking for feedback, or making a final decision? This structure reduces misunderstandings and ensures everyone knows their level of influence in resource-related decisions. At the macro level, which is the next slide, leadership must make systemic changes that support communication. So these are at the organizational level. One strategy is redesigning clinical workflows to remove non-value added work, such as nurses spend a significant portion of their time on tasks that don't require their clinical expertise, which leads to burnout and inefficient use of resources and their knowledge. Streamlining workflow protects nursing time and improves coordination. Another key strategy is integrating collaboration metrics into accountability and performance systems. When communication and teamwork are built into evaluations, promotions, and recognition, staff understand that these behaviors are expected and valued. These organizational strategies help create a culture where communication is consistent, structured, and supported. Next slide. Several stakeholders play important roles in implementing these strategies, two of which are human resources and executive and division leadership. Human resources supports training initiatives, including communication and conflict resolution programs. Executive and division leadership will set the tone by establishing communication standards, policies, and expectations across the units. Our call to action for leadership is to commit to quarterly reviews of interprofessional communication patterns and use real data to reward collaborative behaviors. For staff, the call to action is to use UID decision roles consistently and practice collaborative communication styles to turn disagreements into productive solutions. This combination of leadership commitment and staff engagement is essential for a meaningful change. Next slide. Now, we are going to transition into our small group application. This case study illustrates how poor communication impacts workload, teamwork, and resource management in real time. Here, for example, we have a nurse caring for three high acuity patients. A resident physician orders routine tasks without realizing staffing is short. The nurse is overwhelmed but doesn't communicate this, assuming the doctor should know. The doctor becomes frustrated when tasks aren't completed and reports the nurse, creating tension and wasted time across the unit. So, for the small group discussion, these will be the guiding questions you will explore. First one is, what communication failures occurred here between the nurse and the physician? Which leadership strategies from today's lesson could have prevented this conflict? How could the UID model have changed the outcome? If you were the unit leader, what, what immediate steps would you take to restore teamwork? In the actual session, we would now break participants into small groups for 25 minutes. Now, I'm going to explain how we would facilitate this small group activity portion of this workshop. If this were a live in-person session, we would divide participants into small groups of 3 to 4 members. Each group would receive the case study displayed on the slide. You will have 25 minutes to work through the scenario using the leadership concepts we covered today. This includes the UID decision model for clarifying whether the conversation is meant to update, seek input, or make a decision, or collaborative conflict resolution and negotiation skills, which will help teams address disagreement about workload or resources. The use of media rich communication, such as face to face discussions for complex or ambiguous issues, and understanding when solutions require micro level actions by staff versus macro level changes at the organizational or leadership level. During your small group time, you would read through the case together, discuss the four guiding questions, and identify where communication failed, what leadership competencies were missing, and which strategies could have prevented or resolved this conflict. After the 25 minutes, we would reconvene as a full group. Each team would share one key insight, such as a leadership behavior that could have improved the scenario, a communication strategy, or organizational barrier that needs to be addressed in this case. This activity will give participants an opportunity to apply leadership principles to a realistic workplace situation, and a common one at that, and reflect on how these strategies can improve communication, collaboration, and resource management on their own units in their workplaces. Next slide.
Okay, yes, thank you, Sai and Kanis, about all these details. And now, if you have any question, you're most welcome to ask us for any concern, and we are happy to answer your any question or concern. Thank you. Next slide.
So finally, to address and prevent the poor communication between the doctor and nurses, we have several resources are available. In cases of online resources, we have a joint commissioner which provide the hand of communication guideline. CRICO strategy which provide the resources on communication and patient safety. In the organizational resources, UT Southwestern website provided workshop on for interprofessional collaboration and team training module to improve the nurse and doctor communication. Additionally, we have created an infographic summarize the overview, key factors and implications of the poor communication between the doctor and nurses. This slide is showing that our infographic. We can be use this infographic as a takeaway handout for staff to increase learning and promote better teamwork. In our next slide,
Yes. Now, about the feedback, all of you are most welcome to give any to fill this short survey form, and we really appreciate to improve our future any project or anything. You have a QR code to scan and to fill the form online, or you can go to the link directly and click on it and fill the form. And once we get your responses, and we will go through it for any future improvement. Thank you so much. Moving forward, yes.
This is a slide for our references. Thank you so much for your patience hearing. If anyone have any questions about our survey, so please contact with us. This is our email address. Thank you all. Thank you,
Thank you.
Nadia. Thank you, Sai.
Thank you.
Thank you.